Hello, and a very warm welcome to the latest in our live and ticking series. I'm Alexandra Milsom, and I'm Director of Research Relations here at the BHF. It's fantastic to see so many familiar faces join us again. For those of you that are joining for the first time, to let you know, these events are recorded, which gives you an opportunity to go back and watch any you might have missed. And for those of you who couldn't join us last month when we were discussing health inequalities and heart disease, it was really interesting. So if you get a chance, do go back and check it out. You can find the recording along with all of our other events on our YouTube channel. A reminder as well that we actively encourage questions throughout. So if you have a question, drop it into the Q&A function, and any we can't answer within this hour's programme, we'll endeavour to get back to you after the event. Before we delve into the fascinating topic of hearts and minds, I do have some exciting BHF news I want to share with you first. I want to let you know about a very special programme that's just launched at the BHF, called My BHF. It's a personalised health and wellbeing membership programme, supported by up-to-date research and our own team of internal experts. It's the first of its kind for the BHF, and not only is it designed around your needs to help you feel at your fittest and healthiest, both physically and mentally, but your membership also helps us continue to fund vital life-saving research. So if you'd like to find out more, please do visit our website or check out the link in the chat box. And now to the main event. So this afternoon, we'll be exploring the connections between our heart health and our mental health. Following a challenging year for many, May has seen a focus on mental health, including the recent Mental Health Awareness Week. We wanted to share with you the latest BHF-funded research on the topic and the BHF resources and programmes available to you in support of both your mental and physical health. To discuss the topic in more detail, I am delighted to be joined by three fantastic speakers. We have Dr. Lisa Pennells from the University of Cambridge, who will be sharing her research into the connection between depression and cardiovascular risk. We have Will Elwes, who will be sharing his experience of running the BHF's hugely successful One Beat programme, which supports young people living with a heart condition. And Rory Wade, who will be sharing his personal experience of being part of that One Beat programme. As we're loading the slides, now seems a good time to do a poll question. There'll be a few of these throughout the event. And our first question this afternoon is how much do you feel you know about the connection between mental and cardiovascular health? Rating from 1, not at all, to 5, very much. Right, the results are in. That's interesting. So we have a number of people joining us today are at that lower end of how much they feel they know about the connection between mental and cardiovascular health. So we have around a third of participants rating it at 2 and a third of our participants rating it at 3. So the majority rating that 2 or 3, with just a couple of people up at that 4 and 5. And so let's hope we can improve that by the end of the session. So to begin, let's look at a few facts and figures. Today, there are more than 7 million people living with heart and circulatory diseases in the UK. Many millions more have risk factors for these conditions, such as high blood pressure, raised cholesterol, obesity, or type 2 diabetes. We know that people with health problems, not just those with a heart or circulatory condition, can experience poor mental health. Research is also helping us better understand whether the symptoms of poor mental health, such as depression, affect our risk of developing a heart or circulatory condition later in life. and Dr. Pennell will be sharing her latest research findings on that particular topic in a few minutes. So what do we mean by mental health? Well, it's an important part of our overall health and well-being, including our emotional, psychological, and social well-being. And it's an essential part of how we think, feel, act, and make choices. We know that people living with a heart and circulatory disease can experience feelings of depression, anxiety, isolation, and loneliness. And the emotional impact of caring for a loved one with a heart condition can also have challenges in terms of mental health. So at the BHF, we have a range of resources designed to support patients and their families right from the outset. Sorry, I've paused for a minute because I have accidentally fast forwarded the slides. Let me just go back one. So starting with our heart helpline. This is staffed by our experienced cardiac nurses and dietitians who can be contacted every weekday via phone or email. They can help with queries and concerns from walking you through a new diagnosis or recovery after a hospital stay, through to understanding your test results or medications and their side effects. They can also direct you to resources or further support that could be helpful to you or your loved ones. During this unsettling time, we know that many people have questions related to cardiovascular disease and COVID-19. And our nurses are here for you, just a call or an email click away. So please reach out if you need them. We also offer online communities and local support groups across the country, so you can find community support that's right for you. An example of this is Health Unlocked, which is a free online community created to give people with heart and circulatory disease a chance to speak to others in similar circumstances. Again, our cardiac nurses are also on hand as part of the community to answer questions and provide information. We also have Teen Heart, which is a fantastically friendly support group for teenagers aged 13 to 18, with everything from newsletters and a Facebook page to organised events such as adventure weekends and escape routes. We also have for 18s to 30s 1B, a powerful support network that not only offers the opportunity to join events and meet new people, but also builds skills, and through supporting the development of resources and content for the BHF, also provides a voice for young adults living with heart and circulatory disease in the UK. And we'll hear more about that from Will and Rory a little later in the programme. Alongside our patient support, the BHF is the largest independent funder of cardiovascular research in the UK and one of the largest in the world. And we want to answer two important questions that allow us to better understand the connections between mental health and cardiovascular disease. How does our mental health affect our risk of developing cardiovascular disease later in life? And how does having cardiovascular disease impact on our mental health? And to better understand this relationship, BHF-funded researchers are examining the behavioural, psychological, biological and genetic factors involved. The first broad area of study is looking at the relationship between mood, lifestyle and risk. For example, because low mood symptoms such as depression, anxiety or stress can lower people's motivation to exercise or eat a healthy diet, there are currently long-term studies following people over many years that examine the impact of this, including whether traumatic events like relationship breakups can impact on our lifestyle choices, our behaviour, and therefore our cardiovascular health in later life. Another broad area of study is to better understand the biological connection between mood and heart and circulatory disease. And that's because previously it was thought that mood or mood disorders led people to make less healthy lifestyle choices, which subsequently increased their risk of heart disease. And although this does account for some of the risk, there are some elements that we can't yet explain. For example, why we see an increased occurrence of depression in certain conditions such as coronary heart disease. Is it that low mood increases our risk, or that biological changes in our body during the development of the disease are also having an impact on the parts of our body, like the brain, that regulate mood? For example, there's a region in the brain that receives emotional information and also regulates processes such as heart rate and blood pressure. And BHF-funded researchers are currently looking at how this brain chemistry changes when a stress response is created or blocked. And these results could reveal how stress influences our heart and blood vessels and could lead to new approaches to treating people with mood disorders who might be at risk of developing cardiovascular disease. The final set of studies are examining ways to improve the quality of life and therefore the mental health of people living with heart and circulatory disease. For example, we recently awarded funding to researchers who are investigating the quality of life for people waiting for a heart transplant. In this situation, patients often benefit from having a mechanical pump surgically attached to their heart. But the device can have negative impacts on their life, such as sleeping with a monitor. Researchers will work with patients before and after the device is fitted, so they can capture the range of issues that patients face and build this insight into standardized questionnaires, which will help patients and their doctors better assess and improve support for these patients in NHS. Through research studies like these, we hope to develop a much greater understanding of the relationship between our heart health and our mental health, which we hope in turn will help us develop more effective prevention and treatment. Without further ado, it is with great pleasure that I introduce to you Dr. Pennells from the University of Cambridge, who's joined us to talk about the results of her BHF-funded research. So Lisa, I'm going to hand over to you.
Thank you so much for a wonderful introduction, and thank you also for the invitation to speak at this event today. I feel very privileged to be doing so, and I sincerely hope that you find what I have to say interesting. So let me share my screen with you and start my slides. So the first thing I want to do is just give you a quick overview of the research group that I work with. So we are the BHF Cardiovascular Epidemiology Unit, or CEU, based at the University of Cambridge. And our work there focuses on the study of the causes and prevention of cardiovascular diseases. So we are a mixture of people with various different expertise: cardiologists and clinicians, epidemiologists, geneticists, analysts of various sorts, as well as administrators who help kind of glue us all together. And all of the work we do is very much based on team science, so bringing together expertise from various different backgrounds, not only within the group, but actually experts from around the world as well. It's very much collaborative work. And we focus on numerous aspects of CVDs, so from genetics to molecular pathways of disease. We're always keen to try and translate any of our findings to be useful in clinical practice. And a key area of interest of mine actually is CVD risk prediction. So trying to harness any of the latest findings to help us better predict who's likely to be high risk of future disease in the population. So hopefully we can intervene to try and prevent disease. So that's an overview of the unit. And before I delve into the particular project I want to share with you, I'm going to start by asking you as the audience a poll question. So thinking about the global burden of disease, so not just disease within the UK, but across all countries in the world, which of these 5 listed conditions here would you anticipate to be in the top 15 causes of productive life years lost due to ill health, disability, or early death. So which are in the top 15 in terms of the burden they create. So you could select all of these or just a selection of those. So please select on your screen now. So results are in, and I'm seeing high numbers of people selecting heart disease and depressive disorders. I guess the clue is in the title of my talk. Also, about 50% of people selecting stroke, slightly fewer people selecting lung cancer and breast cancer. So let me move to the answer. So these results are produced by the Global Burden of Disease study in 2019. And they highlight that our cardiovascular diseases, heart diseases and stroke are on the number 2 and number 3 top causes of burden of disease across the world. But depressive disorders is indeed up there as number 13 and above both the lung and breast cancer. So I think you all did really well in that poll and correctly predicted that. And for me, this really highlights the importance of research into CVD and depressive disorders. And I'm going to talk now about a project that tries to link the two. So this slide gives you a little bit of background on this link. So we know that links between depressed mood and heart disease have been observed over many hundreds of years, actually. You can find reference to this in the literature dating back more than 300 years. And in the 20th century, we've started to take a more scientific approach to investigating these links. So initially, studies have observed increased rates of depression among individuals that have CVD and indeed linked depressive symptoms to poorer prognosis in these individuals. In more recent decades, there have been many studies that have focused more on healthy individuals, so people with no CVD initially, and then found that there was an association between having depressive symptoms and future risk of CVD. So in epidemiology, we're not keen on taking results of any individual studies. We like to pull together results from various studies to get a consensus about links between exposures and diseases. And there have been a number of publications which have done this by taking the published results from various studies and what we call meta-analysing them. And again, these studies tended to confirm there was an association between depressive symptoms and future risk of CVD. So in the work I'm now going to present, we've extended on this further. So pooling results from published studies has limitations because you're constrained by the way that the original researchers analysed their data. What we've done is take the original data from multiple studies of cardiovascular disease to help us more flexibly characterise this association between depressive symptoms and CVD in much more detail. And the technique involved in this kind of analysis is called individual participant data meta-analysis. So in terms of the data sets we've used data from the UK Biobank. So this is a huge study of 500,000 individuals across the UK. And in these people, they answered a questionnaire at recruitment, and blood samples and physical measurements were taken. And they were then followed up now for just over 10 years for various disease outcomes. And in terms of this analysis, we've used 2 core questions on depressive symptoms that were asked in this initial questionnaire. And these relate to frequency of depressed mood over the prior 2 weeks to recruitment, and also pleasure in activities over the prior 2 weeks. And these two questions together comprise what we call this PHQ-2 depression score. And people can get a result on that ranging between a 0 and a 6, with 6 indicating the more severe depressive symptoms. So in terms of our analysis, the individuals in this study that we were able to use that had the relevant information, we had about 400,000 individuals. And importantly, these people were essentially healthy at baseline, so no prior cardiovascular disease at recruitment. The other data source that we've used is the Emerging Risk Factors Collaboration. So in the CEU, the group where I work, we're the coordinating centre for this big collaborative work that's built up over many years. We now have data from over 140 studies on cardiovascular disease and 2.5 million individuals contributing to that. We've obtained various measurements at baseline, and again followed, there's follow-up in these studies for, in some cases, 30 or 40 years for cardiovascular disease outcomes, as well as various causes of mortality. So for the purposes of our analysis on depressive symptoms, 21 of these studies had the information we needed, and we used about 160 individual data records from people with no prior disease. So within these data sets, we focused our analysis on a different depressive symptoms score known as the CESD Depressive Symptoms Questionnaire. And this focuses on 20 different questions about mood during the last 2 weeks. And this gives individuals a score ranging between, between 0 and 60. So the aims of our analysis using this data, as I said, were to better characterise this apparent association between depressive symptoms in otherwise healthy individuals and their future risk of cardiovascular disease. And within that, there were various questions we wanted to answer, but these are the two key ones. We wanted to know whether this association was independent of other cardiovascular disease risk factors, such as high blood pressure and high cholesterol. Or could these other factors be somehow explaining this association? The other thing we were really interested in is what was the nature of any association. So does risk increase steadily with depressive symptoms, or do you need to be quite severely depressed before we see an increased risk? And having this individual participant data from all these studies really made it possible to delve into this and answer these questions in detail. So this slide gives you one of the key results from the work. So here we're looking at results from the Emerging Risk Factors Collaboration and UK Biobank separately. And what we've done essentially is split people into 5 groups according to their depressive symptom scores. And then we've looked at the incidence of CVD events within each of those groups. And you can think of this incidence as it's expressed on the y-axis as the number of events observed per 1,000 people over 10 years. And what we see if we look in our top 5th in terms of depressive symptoms and compare that to the lowest group, we see a slight increase in the number of CVD events. In the case of the ERSC, we've got 63 events in the top group versus 54 in the bottom. For UK Biobank, the numbers are 36 and 25. So there's a slight increase in risk, but perhaps more importantly, what we saw was that this risk increased steadily with depressive symptoms. So there was no obvious threshold at which risk increased. And the red line that I've shown on each of these plots is actually the threshold that's conventionally used with these 2 depression scores to define whether somebody potentially has a depressive disorder. So it's not a full clinical diagnosis, but scores above this threshold are indicative of a potential depressive disorder. And importantly, we're seeing increased risk of CVD in individuals that have depressive symptom scores below this threshold. So these are people that perhaps wouldn't come to the attention of a health professional in terms of depression diagnosis. So our next step was to try and put this association into context in comparison to other well-known risk factors for cardiovascular disease. So we compared with associations that we see for blood pressure, for cholesterol, and for body mass index. So now the results that I'm showing you are expressed in terms of standard deviation increases in these different risk factors. And that enables us to make a fair comparison across the different risk factors. So a standard deviation is a measure of how much something varies in a population. So you can think of it as the average difference between a single person's measurement of that factor and the mean for that study population. So it's a comparable unit of increase that we can compare across the different risk factors, if you like. So what we see here is with a 1SD increase in depressive symptoms, we see a 10% increase in CVD risk. And this is actually much less than we see for other well-known CVD risk factors. So for blood pressure, for example, we see a 32% increase in risk per 1SD increase in systolic blood pressure. So we did various other things also to sort of check how robust this association that we observed was. So one of the things we did was we also allowed in our analysis for a vast range of other CVD risk factors these factors tend to be associated with both depression and cardiovascular disease. And they might be explaining some of this association that we see. And actually, after adjustment for this vast list of different potential risk factors, our results were unchanged. We still saw the same association between depressive symptoms and CVD. The other thing we did was we removed people from our analysis that had CVD events during the first few years of follow-up. So the rationale for doing this was that we wanted to ensure that people were not expressing depressive symptoms at recruitment because of underlying poor health and perhaps underlying cardiovascular disease that had not yet been detected. And this is a phenomenon known as reverse causality. So what we saw when we removed these individuals, and actually even removing individuals who had CVD events during the first 9 years of follow-up, we still saw a similar association between depressive symptoms at year 0 and events occurring after 10 years, which was quite astounding. We didn't expect it to remain the same. So these are my conclusions. Essentially, we concluded that depressive symptoms were associated with future risk of CVD incidence. And this association was present even at symptom levels below the threshold indicative of a potential depressive disorder. The associations persisted after adjustment for several CVD risk factors and our attempts to limit the possible effects of reverse causality. But thankfully, this association appears to be quite modest, and it's certainly less than that which we see for other well-known causal CVD risk factors. However, it's not possible to conclude from this analysis that depressive symptoms cause cardiovascular disease. So the kind of observational studies that we've been working with don't really allow this kind of conclusion, because there may be many other unknown factors at play that we've not been able to control for in our analysis. But I guess what this analysis does do is add further evidence that future research is worth doing and is needed to better understand the the underlying mechanisms behind the association and investigate the possibility of causality. So I just included one quick slide here to sort of outline what the challenges are with this kind of research, because you might think, you know, we've got more than 300 years of anecdotal evidence and several decades of scientific evidence, and we're still saying we need more research to understand this. And I think the reason for this is that the mechanisms behind development of cardiovascular disease are multiple, they're complex and they're interlinked. As are any mechanisms which are behind any link between depression and cardiovascular disease. And probably different pathways are implemented for different people also. Adding to this is the fact that our measurement of depressive symptoms is not an exact science. So it's not quite like where you take a blood sample from someone and you measure their cholesterol and you get a number for that. We're relying on questionnaires and people to tell us their experience of depressive symptoms. And it can be quite hard to really understand what is the underlying exposure we're capturing there. So between all these complications, it's really challenging to put together the pieces of this puzzle. And that's why we're concluding that further research is very much needed. So I'm sorry I can't give you more definite answers with this piece of work. But hopefully you found it interesting, and I think a clear take-home message is that our mental and our physical health certainly go hand in hand. And I love this photo because it summarises that for me in a very positive way. So thank you for listening, and I'm going to put up one last slide which just acknowledges my collaborators in this work, so Eric and Emanuele, who I work with in Cambridge, and Karina and Joe, who are based in New York. Karina is one of the PIs of one of the ERFC studies, and she has been a real mastermind actually for this whole project. And thank you to all our ERFC collaborators who've trusted us with their data over the years. And if anybody wants to read more about this research, I've included the reference to the paper where full details have been published. Thank you.
Oh, thank you, Lisa. That was absolutely fantastic. And another piece in, as you said, a jigsaw puzzle of these relationships between our heart health and mental health. We'll now turn our attention to some of the support programs offered at the BHF. And it's my absolute pleasure to introduce Will Elwes next, who's the Program Manager of OneBeat. Will, over to you.
Hello, everyone. So today I'm going to be talking about our groups for young heart patients at the BHF. So let me just start my slides. Can everyone see that? Okay, so currently the BHF runs 2 peer support groups for young people with heart conditions. The first is Teen Heart for 13 to 18-year-olds, and then we have a follow-on group called OneBeat for young adults. We call them peer support groups, and peer support means the help that people going through similar situations are able to give to one another. This can be through exchanging advice, providing understanding, and reducing the sense that you're dealing with something on your own.
Will, do you mind if I jump in a moment? I think we might have a challenge seeing your slides. You're explaining it fantastically, so if there's a problem, that's not a worry at all. But would you mind resharing your screen?
Sorry about that.
Perfect.
Is that better? Can you see my slides at the moment?
Perfect,
Yes,
thanks, Will.
we can, Will.
Okay, brilliant. So our first group is Teen Heart for 13 to 18-year-olds, and Teen Heart has over 300 members across the UK. Teen Heart members have congenital heart conditions. So these are heart conditions that you're born with. And what our aim is to create a group setting where teenagers feel accepted and understood, and that they can meet others with similar challenges. In pre-COVID times, Teen Heart holds events like outdoor adventure, cooking lessons, and media workshops like film and animation. During the pandemic, all our events have been virtual through Zoom, so things like art workshops, quizzes, and baking. We've been pleasantly surprised about how well virtual events have worked, and they have advantages as they allow members from across the country to meet together more frequently. So we hope to move at the end of the year to a combination of face-to-face and virtual events. So how does a group like Teen Heart benefit patients? So one of the benefits is to reduce feelings of isolation. So many teenagers will have missed out large parts of their education due to long hospital stays. They may also have not really met another young person their age with a heart condition. So the group provides an opportunity to meet others they can relate to, and allows them to build a friendship network, which they can carry through to adulthood. We also like to provide a learning outcome for every event that we host. So this can be practical skills like cooking or photography, or more of life skills like teamwork and leadership. And as our Teen Heart members get older, they can join One Beat. So One Beat is our group for young adults. It has over 650 members, and it's for 18 to 30-year-olds. And it has similar aims to Teen Heart, but it has a bit more of a focus on self-development. This is because members are taking their next steps in life. So this can be leaving home, starting university, or starting a new job. So how does a group like Teen Heart One Beat benefit patients? Well, we like to provide opportunities to hear from role models. So these are inspiring people living with heart conditions from the worlds of entertainment, business, and sports, who come and talk to the group about their journeys and careers. As well as providing inspiring role models, we provide a space to discuss heart-related issues. So we have regular heart talks, which are events to talk about topics like mental well-being, employment and looking for work, as well as scars and body image. Finally, our One Beat members really like to give back and help others. So we work with them to create new resources for young heart patients. So things like films, web pages, and print information. And this really helps to ensure our resources are relatable and not overly complex and include too much medical language. So that's my part done. So I'm going to hand you over to Rory Wade, who is a member of our One Beat group.
Hello everyone, I am going to share my screen now. Can you see it? You can see my screen, brilliant. Okay, yes, so my name is Rory, and I'm one of the young people that has benefited hugely from the BHF's Youth Engagement Programme. So to kick off, always the elephant in the room is, what have you got? So I have subaortic stenosis with mitral valve regurgitation, for those who are familiar with that. Also discovered during my last surgery that I have long QT. I had two major open heart surgeries, one when I was 3 years old that luckily I only have quite fond blurred memories of, and another in 2010 pictured here, which I would regard as both the worst and the best thing to happen in my life, and I'll get onto that. And I'm 24 years old and from Cardiff. So when thinking of kind of the relationship between heart and mind for myself, I mean, I don't think this picture is a great representative. I think it's a much more strained relationship between heart and mind for myself. But a lot of the keywords that have come from my own experiences has been this, and maybe some of this resonates with some of you, and feel free in the chat to put your own keywords, or kind of, general in this. This can be almost like a conversation around kind of your own experiences with mental health. But I'll go into detail into some of these. So I was lucky enough to have cognitive behavioral therapy, CBT, which unearthed a lot of my own kind of core beliefs that trigger my anxieties. And I hadn't realized actually that my heart condition had played a huge role in that. So a first one is that life is too short. So my kind of anxieties with this will be, because of, in 2010, when I had surgery, I had a cardiac arrest afterwards, and it's very hard to reintegrate into society and to live as usual when you've been told that you technically should have died. There's no guidebook for how to deal with that, and so I think I interpreted it as a second chance at life, and that I absolutely have to live the best life, therefore, and that every decision I make needs to lead towards the best life. So that means even irrational things like what food to order at the restaurant, what clothes to buy, where to go out on a Saturday night, like everything has to be the right decision, and that creates huge anxiety. So interestingly, my therapist's advice for that was order the second best thing on the menu, or make a wrong decision and see what good comes out of it. Second core belief, social anxiety. I put an asterisk there because actually I love meeting new people. I'm very extroverted, and that definitely didn't come overnight. I worked a lot on that. But growing up with a condition.
Rory,
yeah.
Can I jump in quickly? I love
sure.
the extroverted bit. I think there might be an extra box about colour sitting on the front of your screen, in front of the share screen. Do you have
extra box about colour?
Yes, a panel that seems to be blocking the slide.
Let me stop sharing and try again. Thank you so much. Thank you. Okay.
You're welcome.
Can you still see the screen?
We can see you.
Oh yeah. Okay, let me get back to screen sharing. Thank you very much for letting me know.
I'm very excited you're from Cardiff, Rory.
Are you also?
Yeah, also.
Nice. Is everything good now?
Yes.
Brilliant. Okay. Excellent. So again, growing up and be, around the age of 3 and 4, which are very key socialization ages where you learn how to make friends and what's right or wrong socially. I was in hospital a lot of the time, so I always had to catch up. Like, I actually remember one of my teachers explaining me how to make friends. And I think, growing up then, school was very difficult for me. I was lonely a lot of the time. And sometimes struggled to relate to people, and I missed half of year 8. And so, still today, I have a fear of having arguments with people or falling out with anyone because of that idea of being lonely again. And so the advice I was given for this was have a disagreement with someone and see if you're still friends afterwards. Interesting ideas. So ultimately, these are double-edged swords. So I've talked a lot about the negatives, but at the same time, the first core belief probably has led to me to really living quite a fulfilling life, really throwing myself at things, being very busy. And then the social anxiety has blessed me with a lot of friends and really putting myself out there. So where does the BHF come into this? So in 2014, I was about 17 years old, and I just decided to Google groups for young people with heart conditions, and their old program, which is now Teen Heart, Meet at Teen Heart, came up. I signed up for an event at Bristol Zoo and then a residential, and it just changed my life in a way because, of course, you have friends outside, but they will never fully understand how having a heart condition influences your rationale and the way you are. Whereas in this environment, it's just so empowering to be around people that already have that understanding. I'll talk a bit about kind of some of the events and qualities it's given me, but two key moments would be what you see in the top middle there. So my friend David I met through here, he's on the bottom left as well. He got married just before COVID in 2020. So myself and Charlie, another member, went up to Scotland and went to the wedding, and that highlights, you know, the blessing this has given in my life, and also very moving for me to see, you know, someone else with a heart condition can still do things like marrying someone and things like that, because again, relationships is another layer. Another key event was on the day, actually the 10th anniversary of my operation, and also the day that I and the rest of us had to go into isolation earlier than others. We had a group call, and that really set the tone for the rest of the time, and made me feel a lot less alone. You know, we're all in this together. And then exactly a year later, we did the same to really reflect over the year. And I think what was beautiful was that in that second call, we had a lot more new people who we didn't know a year before, who, because One Beat then switched online and was doing events almost fortnightly, it was more accessible to people, and that was brilliant as well. So some of the best things that One Beat and Meet at Teen Heart's given me is the opportunity to tell my story. I love doing that now. I love kind of sharing kind of how my experiences have been. So on the top is a video the BHF did for mental health awareness last year. And then on the bottom is me actually speaking about safe sex, but still important, for a transitional video that the BHF did for young people transitioning to adult care. And that's something that is very empowering for me. Opened, and, you know, on that level as well, I think one of the most like a real changing moment for me was at this residential, just having a frank conversation in a group about how it is to have a heart condition, even simple things like how do your siblings react to you. That was one of the most effective things for me, and made me realize how lucky I am in some ways. And also something great the BHF have done is our heart talk. So this was roughly, you know, about once a month now, where we can submit topics where, you know, it might be getting a career and having a heart condition, or coping at uni, or peer pressure about, I don't know, alcohol and stuff, and just having an open discussion. And that's an incredible kind of group therapy thing. Compensation for a lost childhood, teenagehood. It's something that I probably always will be resentful of, is that, you know, having a heart condition has kind of denied me that. But the BHF has done an incredible job at allowing me to have events like here at an adventure park, or doing things I normally wouldn't have confidence to do in an accessible way. And finally, empowerment. So all of these things, experiences I've had, I've now independently been able to really kind of transform and to strengthen my condition and my story. So on the top left, for Mental Health Awareness Week last year, on the One Beat Facebook group, I just did a 10-minute video pretty much talking about this. And then what followed was all the other members sharing their own stories. And I really loved that feeling of bringing that out of people. And then bottom right, on my 11th anniversary of my operation, I wrote a LinkedIn post about my story as well. And that just showed how far I went, really. So yeah, I mean, all your donations, maybe you don't realize that the human experience it gives you. And over the last 7 years, it's just been one of the best things to happen to me. You know, here to close off, this was me being a heart leader, having the opportunity to empower other young people with heart conditions. And, you know, BHF has really allowed me to put my passions into practice. And I really, really hope that all other young people with heart conditions can have the same experience as me, because it's transformed my life. So thank you, One Beat, and thank you, BHF.
Thank you, Rory and Will. I have to say that was so incredibly powerful. Thank you so much for your honesty, because I think it really helps us to be open and talk about this subject. And to get us talking, we've reached the Q&A part of the session, which will be moderated by Christy. We'll try and get through as many questions as we can, and any that we don't have time for, or that need a particular clinical area of expertise and that aren't anonymised, we'll share them with our clinical team after the event, who will then email you back with a response. Handing over to you, Christy.
Thanks, Alex. And thank you again to all of our speakers. We've had some lovely comments already about the presentations we've had. So my first question is for you, Rory, and it's from a lady called Pauline. And Pauline is asking, how can I come to terms with living with heart failure? So that's not been your personal experience, Rory, but if you could touch on how you have come to terms with living a condition, that would be great.
Yeah, so I don't really live with heart failure, although I guess I can talk a bit about my heart failing in 2010 and how that influences me. But I guess it's about seeing the blessings within it and how it can shape your life philosophy, and maybe you see a value in life more than others. You know, sometimes I get quite frustrated by people who kind of don't see a purpose in their life, and it makes me reflect that I'm like telling them, no, you know, life is a great thing to have. And I think also channeling the worst things in your life into bringing the best out of you. So, you know, that could be through putting all that energy into then activism or empowerment for others, or working for charities or organizations. But again, I don't want to sugarcoat it, because it is a horrible thing, and I have my own fears about it. And you know, I think ultimately just don't hide reality, get clarity, and make sure you're very much informed of the realities of living with heart failure. But ultimately, you know, find what compensates for it, whether that is going into spaces like these to share your stories and discuss with others, or, you know, at least making the best out of the life that you can.
Thank you, Rory. A great answer. We have another brilliant question through, which is for each of you, actually. So how do you keep your own mental health in check? I'll stay with you, Rory, if you've got anything else to add, and then I'll hand over to Lisa to follow.
I mean, there are many ways. You know, I acknowledge that having therapy is not something everyone else can have. I found some self-help books very helpful. One in particular is get your S words together, and those are very, you know, accessible things. You know, I think it's, for me personally, I would say lockdown was the year that I really kind of focused on that and chose to do things that I felt was bringing the best out of me and becoming the person I wanted to be. So investing the time in that, but even having a simple routine like watching, I had a thing in October where I'd watch a film every night and make a diary of those films, like things, at least knowing that each day you're doing something to improve yourself as a person, but also you're having that space to just do something that makes you happy, even if it might not be seen as productive.
Great, thank you. Lisa?
It is a really good question. I think for me, the key thing is exercise, actually, in particular, exercise in green spaces. And in fact, the picture behind me is from a walk I did very recently. And I try and make that part of my routine, so it becomes habitual that I go for a run a couple of times a week in a green space, and making it part of your routine and a habit, I think, is very valuable, because at times when you're feeling low, otherwise it's hard sometimes to get yourself out the door to do things like that. So making it part of your routine is really, really helpful.
Thanks, Lisa. Alex?
Oh, thanks, Christy. I think building on Rory's comment about those little things that bring you success, I built a vegetable bed and attempted to grow rather wonky carrots. But I think I would say I've got two new ways now of doing it. I think if I want to relax in the future, I'm going to give Lisa a call, because I love her background on Zoom. And also, I think listening to reflections, stories like Rory, really put things into perspective for me. I think we have a lot to be grateful for.
Thank you, Alex. And Will, we'll finish with you.
I would also, like Lisa, say exercise. I try and do some running. I don't run particularly fast or very far, but I find that it clears your head and it allows you to sort of reset. So I find that very useful.
Thanks, Will. And Will, we have another question, which I'd love you to feed into. How can BHF resources help to reduce anxiety? You've touched on some of the tools available at the BHF, but if you could expand, that would be great.
Yeah, there's a number of places that you can go for information. So we have the emotional support and wellbeing section of the website, which gives a good overview of topics around anxiety. I'd also recommend the Heart Helpline, where you can speak to a cardiac nurse on the phone about any concerns that you're having. Additionally, there's our online community on Health Unlocked. So there's often posts on there about anxiety from patients, and they receive a lot of supportive advice from other patients, which is really valuable. And then finally, we do have a resource called Preparing for Heart Surgery, which is around anxiety and heart surgery. It's made by our One Beat members, so I always like to plug it. And it covers emotional well-being and fears around surgery. So I think that's going to be posted in the chat.
Great, thank you so much, Will. And Alex, we have 5 minutes left, so I'd like to invite you now to make your closing remarks. And just as a reminder to everybody with us today, we will be answering all of your questions separately. So thanks again for submitting those. Over to you, Alex.
Oh, thanks, Christy. And can I say a huge thanks to you and your team as well for all the hard work that goes on in the background to design and deliver these events. And a huge thanks also to all those who have joined us for this session. And I'm loving the comments and questions in the chat box as well. It's been such a powerful and thought-provoking topic to discuss, and I hope you found the session informative and helpful. I hope you don't mind, but as we're coming to the end, we did have 2 final questions we wanted to ask you. The first is a repeat of the question that we asked you at the beginning. How much do you feel you know about the connection between mental and cardiovascular health? Please rate 1 to 5. It's always the exciting bit when we're waiting for the results to come in. Oh, and fantastic. So we've seen a shift, we've seen a move in those ratings. That's great. It looks like more people are moving up into the 4 and 5 range, feeling like we know more together about this topic. We did have a second question that we'd like to ask you. Has this event increased your likelihood to support the BHF? We don't share the results, but that really helps us to understand how valuable these events are. Thank you. And then finally, if you do have any feedback or suggestions, please share them by completing the survey that you'll receive via email. And it really does help to shape future events and to help us identify topics that might be of interest for our audience. A recording of the event will be available on our website from next week, and we hope you'll join us for the next Live and Ticking event, Wednesday, 30th of June, between 4 and 5, and it's an extra special event because we're celebrating our 60th birthday. And we're delighted to be joined by our research pioneer, BHF Professor Barbara Cassaday, who will be sharing her research discoveries into atrial fibrillation. So please tell friends and family, please come and help us celebrate our 60th. If you haven't signed up already, visit the website. And from myself and the whole of the BHF team, a huge thank you to our fantastic speakers. And a huge thank you also to our audience, to our supporters, who we couldn't do any of this without you. Thank you for joining us this afternoon and have a great evening.